Gaffney. Thanks for joining me again today. And I know no one wants to see the doctor, especially now with high costs of healthcare and high deductible plans. But I know many times I've seen patients in the office who've put off their care, and then when they finally come in, it's just much worse than what they had thought, and it requires offloading with a cam boot, which is like a cast, and crutches. Takes a lot longer to get better. So putting things off can result in tendon tears, infections require IV antibiotics, deformities from fractures that are healing wrong. Just all results in more time to recover, more pain, and more money out of your pocket. So what I've done is put together 6 red flags of when you need to see your foot doctor. Anyway, this is not an all-inclusive list, but we will get into the episode, so stick with us. Everybody, please see my disclaimer in the description. This is not a doctor-patient relationship. This is meant for informational purposes only. It's not medical advice. Hey everybody, so 6 red flags of when to see your foot doctor. Not an all-inclusive list, but it's a good list. So number 1, a hot red swollen area on your foot. So this is a mystery that you don't want part of your body. An astute podiatrists, they're well-versed in complex anatomy and function of the foot. They can help you nail down, figure out the problem. So a hot red swollen area is an inflammatory process, and it's a reaction to something like an infection. Sometimes it's even an infected joint. And waiting to see a foot doctor can result in an infection going deeper to bone or even requiring IV antibiotics. Most healthy people don't have to worry about that. It's more so from diabetics or people with some chronic disease. But even healthy people, I've seen it go way too far and they end up getting bone infection. Also, a hot red swollen area can be a metabolic problem like gout. So although Gouty attacks are self-limiting, and that means it resolves on its own, unchecked gout over time can lead to joint destruction, lack of mobility, chronic pain, among other things. Hot red swollen area can be something like a stress fracture, an injury, and not seeking treatment for this can result in delayed bone healing or non-union or malunion of the bone where it's not healing, and that can cause a deformity. But most of the time, fractures hurt so bad that you end up going to the doctor anyway. The hot red swollen area can be a sign of a stress or strain from biomechanical issues in your foot, and that can affect tendons and joints and cause inflammation. So delaying care in that instance can lead to like a partial tendon tear that may require surgery, or it can cause chronic pain. Another inflammatory process which can cause a hot red swollen area would be an arthritic process, starting out like good old osteoarthritis that my patients affectionately call Arthur. They named it Arthur. It could be undiagnosed also rheumatoid or psoriatic arthritis as well. Okay, the second red flag that you need to see your foot doctor is pain getting progressively worse or interfering with daily living. So it's related to the inflammation we already talked about. So this can be the result of biomechanical issues, which stems from alignment problems of the foot. So certain feet can be twisted in certain ways, or we call it varus or valgus of the forefoot or the rear foot. So that puts stress on the inside or the outside, and podiatrists can identify that and help you with it. But over time, you can get stress and strain on the tendons and joints, and that can lead to tendonitis or even partial tears of the tendon. So it's important to get that diagnosed. Neurological problems such as neuropathy, pinched nerve, tarsal tunnel syndrome, which is carpal tunnel syndrome, but in the ankle, and neuromas or pinched nerves. Having on the top of the foot, it could be a stress fracture, and also many times the joints that are right before the toes, right where the foot ends and the toes are, they get a lot of stress through there, and you can get a lot of inflammation in that area as well. Third red flag is a smelly, draining wound with redness of the skin, pain, and swelling in the area. So you guessed it, it's an infected wound. Most healthy patients can deal with this fine, but still it can get bad, and there's a lot of resistant bacteria out there that needs to be identified, and your doctor would help you to do that. So you do need proper care. You need to identify what's growing in the wound and get it treated properly and get proper wound care. It's especially important in patients with chronic disease like diabetes or people with poor blood flow to their extremities. It can be disastrous. So, and those types of patients, I ask them to call me right away or go to the urgent care or go to the ER to get things taken care of. And nowadays, insurance companies, Medicare, if you have a chronic wound, they do pay for wound care supplies to be sent to your home for wound care, which is great. The fourth red flag that you need to see your foot doctor is an injury. So in the foot, there's a lot of little bones all over the place. There are a lot of little tubercles or protuberances of bones that can avulse with injury. So a podiatrist, we're well versed in foot anatomy, and we take and read foot x-rays every day in practice. So we can identify a lot of different problems, and especially subtle problems on the x-ray. So even with ankle sprains or inversion injuries where you get an ankle x-ray, sometimes it's not uncommon to break your fifth metatarsal, which is in the foot, and they don't take x-rays of the foot when you have an inversion injury of your ankle. So if you end up having pain at the outside of your foot after an ankle injury, go to a podiatrist. They can take an x-ray and see if you have that fifth metatarsal fracture. The red flag is infected ingrown nails. So just say no to bathroom surgery. When it hurts to take it out yourself, it's highly likely you're going to leave a spike of nail in there and your tools aren't sterilized, and you can introduce new bacteria in the area. And podiatrists are great at removing ingrown nails. We do it on a routine basis. We numb your toe. It's very quick. It takes like 5 to 10 minutes in the office. So if you have a fear of needles, just see my posts on 12 tips to conquer your fear of needles. And that'll help you deal with the injection to numb your toe. And that's the only thing that hurts with it. It only lasts for about 30 seconds as far as the pain goes to numb it. The other reason why you need to go and get that treated and looked at is that with an infected ingrown nail, the bone is really close to the nail. So it can get infected if the infection goes on very long, infected in the bone, that is. And if that happens, you need long-term antibiotics or even a bony debridement, which is a surgery to kind of scoop out that infected bone. So it's important to go and get it treated early. Don't work on yourself. Just go get it taken care of. Also, when it's been infected and ingrown for long periods of time, the toe starts to deform and it gets pretty ugly looking. So it's just better to get done and taken care of early. Number 6, the sixth red flag is chronic off and on foot pain. And I understand time flies. People get in the mindset pain will go away. But if you have off and on pain for more than 3 to 6 months, it's a pain that's not going away. And what happens, especially in the foot, it can involve other areas of the foot, and it morphs into the whole foot hurting. And this makes it hard to nail down what caused it in the first place. So the diagnosis becomes difficult, and the pain can move up your leg, and it gets into the hip, knee, and back. So in this instance, with the chronic off and on foot pain, it's common again with the alignment issues that cause stress and strain of the foot, and that leads to inflammation, tendonitis, bursitis. And tendonitis, if it goes on so long, the tendon gets degenerated, so it gets weakened, and you can get partial tears in there, and that can lead to time off your foot and being in a cam boot or even surgery. So good to get that taken care of early. Another thing that causes chronic off and on pain in the foot would be bad shoes, and that causes stress and strain, sort of like the bad alignment. Another thing is arthritis, and although arthritis is not curative, a podiatrist can alleviate pain with arthritis with different shoe gear modifications, orthotics to offload the area, as well as medications. And there's different ways we can stabilize the arthritic area so it's not getting stressed. There's also fish oil and anti-inflammatory diet that can reduce inflammation associated with arthritis. And end-stage arthritis, when it gets to a certain point, you can have your podiatrist do like a surgery to fuse the joint, and that just takes care of the pain instantly after you're done with healing from surgery. or you can have like a joint replacement, like in the big toe joint. That's a common place to get a joint replacement in the foot. Another off and on pain, neurological problems like neuropathy, where the nerves aren't working right, pinched nerves and trapped nerves. These all get worse in time. So those are just some common red flags that you really need to go see your foot doctor for, so things don't get out of hand. And I hope you liked this episode. And if you have any questions or comments, please let me know. And any topics you want me to discuss in the future, please let me know that. And please like and subscribe my channel. I'd appreciate it very much. And we'll see you next time. Thanks a lot. Hey, thanks so much for watching today. If you learned anything or if I've helped you at all, please like and subscribe to my channel. And please leave me comments and I'll answer any questions that you have. If you have any topics you'd like me to cover, please leave that in the comments as well. And I'll do an episode on that in the future. And thanks so much. We'll see you next time.